Good day. I am Julian and we are here today to talk about the case of Mark, a freshman who complains of seasonal pollen allergy since his relocation at college. He's been self-treating his symptoms with over-the-counter medications that his friend gave him. We need to discuss the important questions that we need to ask Mark about his symptoms and the information that he needs for informed use of over-the-counter medications. So what is seasonal pollen allergy? Of course, the main trigger is pollen. So seasonal pollen allergy is an allergy symptoms that happen during certain times of the year, usually when molds, grasses, weeds, trees, and other plants release their spores. Pollen is transported by birds, insects, and wind, so they can be anywhere and we are easily exposed to it. The common symptoms of seasonal pollen allergy can be sneezing, itchy nose or throat, nasal congestion, runny nose, coughing, itchy and watery eyes. The important questions we need to ask Mark about his symptoms is first, so we need to ask Mark what age did his allergic symptoms started so that we know what management he has been doing since and if it is the contributing factor to his present condition. Second is we need to know if he is diagnosed with seasonal pollen allergies. We need to know if he undergoes a skin test or allergy blood test conducted by an allergist. This test is done to identify allergies to common allergy triggers. If you're allergic to the substance, a reddish, elevated bump will appear when a small amount of substance was pricked in your skin during the test. This is to make sure that the pollen is really the trigger of Mark's allergy. We also need to ask to what extent does his symptoms manifest. If it hinders his daily activities, maybe he needs to change his management of the allergy or he can consult his doctor. We also need to ask about the potential allergens that is in his immediate surroundings. This can be a big factor for his allergic reaction. If the dorm he lives in is surrounded by trees or plants or if they have molds in the house, these can be the cause of his allergies. If this is the case, Mark can close the windows and doors to minimize exposure to pollen and use masks whenever going out to avoid inhalation of pollen. So these are common over-the-counter medications used to treat seasonal pollen allergies. First are nasal steroids, antihistamines, and decongestants. So the information that Mark needs to know in taking over-the-counter medications are: follow the instructions on the drug label. Do not take over-the-counter medications longer or in higher doses than the label recommends. Next, the over-the-counter medicine that you take could interact with your other medications, supplements, foods, or drinks. Next is some medications are not right for people with certain conditions. Like in decongestants, people with high blood pressure cannot take them because it raises the heart rate and blood pressure even more. Lastly is allergy to medication. If you're unaware of your allergy to medication, you might unknowingly take a drug that you are allergic to and it can worsen your condition even more.